Welcome to the infection awareness zone of the infection tube, the safe zone. I'm Spark, and today we're diving into something really important, Mpox. But don't worry, I'm not alone. We've got Dr. Henry here to help us understand everything. Dr. Henry, what exactly is Mpox?
Great question, Spark. Mpox, also known as monkeypox, is an infection that causes fever and a painful rash. It was originally discovered in monkeys, hence the name monkeypox, but it was officially renamed Mpox in late 2022.
Wow, I didn't know that. And I've heard that Mpox wasn't really common until recently. What happened?
Exactly, Spark. For many years, Mpox was uncommon, but starting in 2022, we saw a significant increase in cases, including in countries like the US, where it wasn't typically found.
That sounds serious. So, what symptoms should people watch out for?
Symptoms usually start between 5 and 13 days after infection. Many people experience flu-like symptoms first: fever, headache, fatigue, and swollen lymph nodes. Then, a few days later, a rash appears.
And this rash, it sounds pretty uncomfortable. Where does it usually show up?
The rash can look like pimples or blisters and might start in the genital or anal area. It can also spread to the face, mouth, hands, feet, and other parts of the body. The bumps swell with fluid, then pop, dry up, and form scabs, which eventually fall off.
Ouch, that does not sound fun at all. So how does Mpox spread, Dr. Henry?
Mpox can spread from animals to people, but more commonly, it spreads from person to person. This happens through direct physical or sexual contact with an infected person's rash, scabs, or body fluids. It can also spread by indirect contact, like touching items that have come into contact with an infected person.
So, it's really about close contact. And that must mean anyone could be at risk, right?
Absolutely, Spark. Anyone who has close contact with someone infected can get Mpox. When cases surged in 2022, many of those infected were men who have sex with men, but it's crucial to understand that Mpox can affect anyone regardless of gender identity, sexual orientation, or practices.
Got it. If someone thinks they might have Mpox, what should they do?
They should contact their doctor or nurse immediately and avoid close contact with others until they've been seen by a healthcare professional.
And is there a way to test for Mpox?
Yes. If your doctor suspects you have Mpox, they will swab your rash and send the sample to a lab for testing. They might also run blood tests.
What if someone was exposed to Mpox but doesn't have symptoms yet?
If you've been exposed to Mpox, tell your doctor even if you don't have symptoms. You'll need to monitor yourself for symptoms for 21 days and contact your doctor if you notice anything unusual.
What about the Mpox vaccine? Who should get it?
Vaccination is recommended for those who know they've been exposed to the virus. This is called post-exposure prophylaxis. It's important to get vaccinated before symptoms start for it to be effective. Vaccination is also recommended for people at higher risk, which is known as pre-exposure prophylaxis.
And what about treatment? How do people get better from Mpox?
Most people with Mpox won't get seriously ill and can recover at home in a few weeks. In some cases, doctors might recommend antiviral medicines to help with recovery.
But if someone has Mpox, what can they do to avoid spreading it to others?
If you have Mpox, the best way to avoid spreading it is to self-isolate until your rash has fully healed. Wash any clothing, bedding, or items that have touched your rash, and be sure to wear gloves if someone else needs to handle them. Also, wash your hands often, and if you must be around others, cover your rash and wear a face mask.
And how can people avoid getting exposed to Mpox in the first place?
The best way to prevent Mpox is to avoid close contact with anyone who might have it. If someone in your household has Mpox, they should self-isolate until their rash is fully healed. Avoid close contact, including sex, until their rash is completely healed.
That's some great advice, Dr. Henry. Where can people learn more about Mpox?
For more information, you can visit the U.S. Centers for Disease Control and Prevention website. Staying informed and taking the right precautions will help keep you and your loved ones safe.
Thanks for staying with us this episode in the Safe Zone. Don't forget to like, subscribe, and share this video to help others stay safe too. See you next time.